Hello, everyone, and welcome to the Hepatitis Appropriations Partnership's Hill Visit Advocacy Training. We're excited that you're joining us on the Hill, whether virtually or remote, as we leverage our collective expertise to educate Congress on the hepatitis epidemic and call for greater investments in the nation's viral hepatitis programs. So my name is Julio Contreras, and I convene our monthly HAP meetings. I'm a senior associate on the Policy and Legislative Affairs team at NASTAD, or the National Alliance of State and Territorial AIDS Directors, where I support the hepatitis and drug user health policy portfolios. And I'm joined today by my colleague, Daniel Raymond.
Hi, everybody. I'm Daniel Raymond. I'm the Director of Policy for NVHR, the National Viral Hepatitis Roundtable, which is a network of advocates, health officials, clinicians, patients, and other stakeholders working to eliminate viral hepatitis as a public health threat in the United States by 2030.
Thanks, Daniel. So to get us started today, I wanted to cover what is HAP. And HAP is the Hepatitis Appropriations Partnership, which is a broad coalition of national viral hepatitis and HIV organizations, public health and provider organizations, community-based organizations, and diagnostic, pharmaceutical, and biotech companies who are working with policymakers and public health officials to increase federal support for viral hepatitis prevention, testing, education, research, and treatment. The coalition was created in 2004 as the Hepatitis C Appropriations Partnership, but it was renamed in 2010 to reflect our expanded legislative and administrative priorities. And so I'll pass it back off to Daniel to discuss why it is that we advocate.
Thanks, Julio. I think advocacy is a familiar term, but we don't always recognize the different ways that we're practicing it and why we're bringing it to Congress. We're talking now in early 2022, and I think that a lot of people have a lot of ideas that Congress is unresponsive to our needs, not tuned into the people in the communities that the members represent. And I think that it can be very easy to give into a sense of futility. But we've seen over the years that the voices of advocates closest to an issue can move mountains. That when we think about all the things a typical member of Congress has in front of them in terms of the number of bills to consider, the number of votes they're asked to take, the different issues and the whole spectrum, then I think that it's easy to see that if we're not talking about viral hepatitis, then it may not cross their radar screen, and that it's our role to make sure that our representatives are as informed and engaged about these issues and opportunities as possible. We do this in a variety of ways, and other modules in this series are going to talk about some specific tactics, but we talk about the burden of viral hepatitis. We talk about opportunities to eliminate viral hepatitis and how we're well poised with the tools that we have, from screening and vaccination to treatment to harm reduction, to really achieve that vision by 2030. And we talk about how this connects to issues that are on the radar screen already of members who may be outspoken proponents of issues that connect to viral hepatitis, like health equity or immigration or maternal and child health or criminal justice reform or the overdose crisis. But most importantly, we make our issues real to people and go beyond the statistics, go beyond the figures, and really talk about the direct impact that we see in our day-to-day lives, in our work, in our communities. That includes the voice of patients and providers as really not just on the front lines, but the authorities of why this is an important issue, not just from a public health point of view, but from a values point of view. That when we advocate for viral hepatitis, we're making a statement about who we want to be as a nation, as a society, what we need to prioritize, and why we can't leave anybody behind. So these are the kind of ways that we advocate and inform congressional offices about our issues, our priorities, our needs. And the more regularly we do this, the more consistently we do this, the more credibly we do this, and the more passionately we do this, the more likely we are to have the impact that we want to have in garnering Congress's support and ideally funding to eliminate viral hepatitis. Julio, I'll turn it back to you to talk a little bit about what appropriations means.
Thanks, Daniel. And as you mentioned, legislative advocacy around the appropriations process is one of the most impactful ways that advocates can improve hepatitis prevention programs across the nation. The chronic underfunding of hepatitis programs can only be rectified by a substantial investment from Congress through dedicated yearly appropriated funds. So how does the actual appropriations process work? Each year, the administration works with Congress to develop spending levels for the upcoming fiscal year in what is known as the congressional appropriations process. During appropriations, Congress allocates spending levels for federal agencies and programs in this must-pass legislation. And why is it must pass? Without an agreement on an appropriations bill, federal funding will lapse, leading to a government shutdown. Because of this, the appropriations process often involves high-stakes negotiations around spending priorities for both parties. The President and the White House typically kick off the appropriations process by providing the administration's spending framework. The White House works with the Office of Management and Budget to develop a budget recommendation, or the President's budget proposal, which is submitted to Congress, typically in February, depending on the timeline. This executive budget proposal is non-binding, but serves as a starting point for congressional negotiations and serves as an opportunity for the administration to signal its policy priorities. Then the House and Senate each develop budget resolutions that establish top-line spending frameworks, after which the subcommittees each draft their spending bills, which are then marked up and compiled into one consolidated spending package. Once the House and Senate finish their spending bills, Congress meets jointly to finalize that consolidated appropriations package, which is then sent to the President for final signature. As hepatitis advocates, HAP meets with the Hill offices of Appropriations Committee members, especially those in the Labor, Health and Human Services, Education, and Related Agencies Subcommittee, and other lawmakers who can impact health spending. Although your Hill Day visits will not specifically target the Appropriations Committee, it's important to build a broad base of hepatitis advocates on the Hill and educate your elected leaders on hepatitis issues and what's needed to address them. Next, I'll pass it off to Daniel to transition us to the next part of our training.
Thanks, Julio. And so as Julio laid out, this is really the period where Congress is seriously going to take up how they want to finance the federal government and what they want federal dollars to go to. I think we all recognize over the last couple of years of the COVID pandemic and viral hepatitis that we've lost ground in numbers of people getting tested and vaccinated and treated, and that we are at risk of losing momentum towards viral hepatitis elimination. So this is why this is such a vital time to bring hepatitis back on the radar screen of members of Congress, that we need to make a strong and robust case that the lessons that we've learned from the COVID pandemic about the importance of having a vital health and public health infrastructure to tackle infectious diseases can readily be applied to viral hepatitis, and that we can show that our country can reach the goals of viral hepatitis elimination by 2030 through greater investment of resources. We know that we can't do this alone. Hepatitis Appropriations Partnership was founded as a coalition, and we want to make sure that our doors are wide open for veteran advocates, for new advocates, for family members, caregivers, community members who are concerned about this issue. And so we want to make sure that everybody has the information and support and training that they need to become effective advocates and make sure that their voices are heard in Congress. This seems like we could be on the threshold of a really important year in terms of laying out the nation's priorities and how the spending that goes to agencies like CDC and SAMHSA and ultimately out to communities like yours can best be harnessed to meet our values and priorities. but that won't happen if we don't collectively advocate and keep advocating. So thank you for joining this module, and you'll hear more about some of the details about what we're asking for and how we're supporting that ask in the next few modules. Thank you, everybody.